Good morning. This is Karen Dotson from the All of Us Research Program at the Medical College of Wisconsin. And we're just so glad that you're going to sit at the table with us today. We're going to have a wonderful and an interesting topic that we'll be talking about, and it's going to be related to alcohol and cancer. But before I get going, I just wanted to remind people that you can always call in if you have questions. We have Dr. Kevin Izzard with us today.
Good morning.
One of my favorite, I tell you. One of my favorite, but this man is so busy. So I really appreciate that he takes the time to come in and talk with us. He's also a co investigator for our program. He works along and also oversees Kareem City Society. So he's a busy man along with his regular job, right?
Good morning. Yes, I am. Well, I'm busy enough. Put it that way.
And also praise leader or something like that.
Yeah. So that's what I do in my free time when I'm not working. I'm involved with my church. I'm an elder at my church, and I'm a praise and worship leader. So everybody, you gotta find something to do that that you can find enjoyment and relaxation from, where you can kind of get in the zone. And music is my thing.
And so that's a good thing. Music is, we talked about that. I think last month we talked about, the comforts of music and what it can do for you. So, just take the doctor's advice and sometimes just go and enjoy some music. But I just wanted to also mention to you that the All of Us Research Program, if you're interested in joining our program, you can reach us at 414-955-2689. The ultimate goal of this program is to build the largest database. And right now we are considered in the world the largest database. So we're excited about that. We're excited about you providing your information to us because it allows for researchers and your physicians to be more knowledgeable about how to be more precise with your health care.
That's right.
What's your comments on that, Dr. Izzard?
So first of all, welcome to the table, everybody. Pull up a chair. If you're not at the table, you're on the menu.
And I don't want to be on the menu. I want to be at the table. So I want you to join us today. And you can call in at 414-444-5250. And, I was just thinking about the holiday. And a lot of us did a lot of celebrations. We were out there enjoying ourselves. And what comes along with celebration a lot of times, Dr. Izzard?
A lot of drinking, and along with the drinking comes, a lot of risky behavior and a lot of fighting and all the other stuff that happens, Yeah. Devo's laughing like he's, no.
It was at his house.
Somebody pulls a knife.
Oh my goodness. Okay. But a lot of that. And,
Wisconsin, Wisconsin, we are kind of an outlier with the rest of the country as far as alcohol consumption. Wisconsin is a big drinking state, and Milwaukee is is the beer capital. We we do a lot of drinking.
We really do. And so when we look at that, when we start thinking about alcohol, we wanted to bring it to your attention that not only does it alter sometimes our behavior, our thoughts, physically, you can get sick from it, if you drink too much, but also it has an effect on our bodies in different ways, Dr. Izzard. You want to speak to that?
The thing about alcohol is this. Alcohol is, I tell people, if I ask someone how much you drink, how many alcoholic beverages do you drink a week? If someone says they drink 14 beverages in a week, if that's 2 a day, that's not so bad. Okay, you're having 2 beers. Now, what we consider a drink is equivalency amount of alcohol in a drink would be a shot has about the same amount of alcohol as a beer, has about the same amount of alcohol as a glass of wine. Okay, and so some people think, well, I don't drink, I just drink beer. Well, beer's got alcohol in it. So, if you drink a 6-pack of beer, that's you got a significant amount of alcohol in you. But if you have 14 beverages and it's 2 a day, not so big a deal. But if you have them 14 on Friday and Saturday, that's another thing. So
they call that binge drinking.
That's right. Yeah. So you're right. It depends on how you distribute the alcohol, and a lot of it depends on your size too. So if you're a big, heavy man, your body's able to absorb that alcohol better than if you're a 120-pound woman. Two two beverages can actually, alcoholic beverages can actually make you intoxicated. And intoxication basically is, when you have more alcohol in your system than your liver is able to detoxify. So anytime you have anything in your body that's not supposed to be there, your liver's job is to break it down and get rid of it. So alcohol is one of those things, and if you have alcohol in your system and your body is able to break it down, that's what's doing it's doing what's supposed to do. But if you have too much that your liver is unable to break it down fast enough, well, then you become intoxicated. You get buzzed. Okay, and so
Buzz, that's one of those words way back in the day.
yep. So you've probably seen the billboards for like buzz drinking, buzz driving. Anytime you get that buzz feeling, that means that your brain is being affected by the alcohol. So,
Well, isn't that what people drink for, to get affected by it?
yeah. So, well, that brings up another thing too,
Really?
because a lot of people, we know that people who are who have an alcohol problem, either they're alcoholic or alcoholic dependent, they a lot of times they're treating things within themselves. So that's, they're treating anxiety, and so they drink, and they might not do it consciously, but they have anxiety, and so they drink alcohol to relax themselves. And so oftentimes, when we try to treat people's alcoholism, we try to look for an underlying cause of it, and maybe they have untreated anxiety or some other psychological issue that's driving that.
It's called self-medication,
It sure is.
because a lot of times we look for something that's going to soothe us and make us feel better. But the other thing that was so significant when I was doing the research related to alcohol is also there's some relationship with cancer.
Mm-hmm.
And
Mm-hmm.
so when I was looking at that, and it was so interesting, and one thing that I read, that when, like Dr. Izzard, you mentioned about 2 drinks for the woman is a lot different. Why is that? Because of size, and also because our bodies digest it a little slower
Mm-hmm.
than the men do. And so that was one of the reasons why it affects women a lot more than men.
Mm-hmm.
On the other side, it can also alter our DNA as far as with our cells, and how cancer sometimes is related to
Yeah.
alcohol.
Yeah, there's a whole another subject called epigenetics. Where this idea. Now, I remember taking biology way back when, and I was in high school, and there was this. People used to think back, back in the 1800s. They used to think that there was an example of a giraffe. So the theory was there was an animal that looked like a giraffe, had a short neck, and the giraffe kept stretching its neck, trying to reach higher up in a tree. And as it stretched its neck got longer, and then it passed that on to its children. Well, we know now what we know about biology. With those who remember your biology, Gregor Mendel, who does experiments with peas. Basically, he was a gardener. He was I think he was a priest, and he started mixing these peas, and found out he can make the flowers of the peas. They can make the flowers red, white, or pink, and pink meant the mixture of the red and the white. And they found they can make the seeds, the peas themselves, either wrinkled or smooth. And so that's why this whole study of genetics came about, because a lot of the work done by Gregor Mendel. But that whole idea was debunked about the animal stretching its neck and passing it on to its progeny. Well, we're kind of coming back to that now, and we are realizing that there are things that can happen to a person after they're born, because it's not just the genes you're born with. There are things that can happen to you in your environment that turn on different genes.
Mhm.
And so so alcohol can be one of these things that can turn on some of these other things that might cause cancer or other illnesses. And we talked in the past about liver disease, and that's a huge problem. There's the 2 big causes for liver disease is one's metabolic. They used to call it non-alcoholic steatohepatitis, but they changed the name now to metabolic associated steatohepatitis. So
Can you say that again?
metabolic.
What else did you say? I,
Yeah,
I
yeah,
know, right? I mean,
right.
like, I want people to really get this because when we hear these terms, I need to break it down a little bit
Hmm.
for the layman.
Yeah.
So sometimes,
So it's metabolic dysfunction, okay, associated, steatotic hepatitis.
hmm.
Okay. I'm sorry, liver disease. I'm sorry, liver
So
disease.
we've
So
heard
we
about
call
that
it
before. Yes.
masled, masled, MASLD. So that's one. That's a condition a lot of us have where, um, because you're overweight and because you're have a high insulin level. Well, what happens when you become overweight, your body becomes resistant to the insulin. So you eat a lot of sugar and stuff. Your body makes insulin as a response to that. Well, that insulin drives that blood sugar from your bloodstream into your muscles and into your liver. Okay, so your liver can't use all that; it turns it to fat, and so you end up getting fatty liver disease. And we know that people that get this fatty liver eventually can develop either cirrhosis, where the liver starts to die, or they can even they're prone to developing liver cancer. And so that's one of the things that causes it. The other one that causes that same situation is alcohol. So alcohol, like I said, the liver detoxifies it. So you get too much alcohol, you start killing liver cells, and if the liver cells die off, then you develop cirrhosis, scarring of your liver. And I think everybody knows about that end result. Someone alcoholics who really drink a lot, they can develop liver disease. But that yeah, when you start killing off your liver cells and they start to grow back and things, you also make it prone to developing cancers. So I think we have a guest come in and talk more about the cancer association with drinking. But we know that drinking can affect your kidneys. Um, it can your kidney cancer risk is higher. Stomach cancer risk is higher. So
Mhm.
um, yeah, you got to be careful with alcohol. We kind of take it for granted because it's legal, and so a lot of people drink. But alcohol is you talking about drugs. Alcohol is the most commonly abused drug.
And you think that because you can just easily buy it over the counter, as long as you're 18 or
Hmm.
21 now, I really forget the age for being able to buy it, but yet and still
21.
21 now, yeah.
Hmm.
So even though it's so easily to buy at that age, and above, yet and still it can be one of the most harmful things. When I was doing my research, doctor, and I was looking at how they were saying that people related to smoking and drinking, and how the alcohol causes the cells not to be able to fight off
Hmm.
certain things as easy, because the alcohol kind of hinders that.
Yeah, the
And
alcohol in your system, yeah, affects your immune system, and so yeah, right. So you're unable to fight off because if you think about cancer, cancers are just kind of rogue cells that, for some reason, the signal in that cell when it reproduces gets turned off, and so that cell keeps reproducing. And so now, your first defense against that is that your immune system sees these cells, these rogue cells, hopefully your immune system kicks in and kills that cell before it goes someplace else and starts to divide and cause problems. But when your immune system's affected, you're not able to kill off of those cells, and so yeah, it makes you more prone to developing cancers.
so, when you start talking about cancer, because I was, doing assessment of some of my friends and family members, and most of them, I mean, I was just talking with my sister the other day, and we were just saying that, as we get older, more and more of our loved ones and people, friends have gone on, and sometimes even younger, some of our friends' children, and it's mostly because of cancer.
Hmm.
And so, when I started thinking about that, I'm like, this really affects our families, our community.
Hmm.
And so, looking at how we can better respond to this major, major crises that we have called cancer
Hmm.
as it relates to our health is so needed,
Hmm.
And
Yeah.
so, as I
Yeah.
keep looking at that, I keep thinking, like, what can we do as individuals? What can we do to make sure that we respond better for our
Oh, you know what I'm
health?
gonna say here because
What's that?
best thing you can do to if you want to prevent yourself from dying from cancer is to make sure you get your screenings done. And
Mm.
the number one cause of cancer causing death is cigarette smoking, still lung cancer for both men and women. If you look at individually, breast cancer most common in women, and prostate cancer in men. So you got to get screened for those things. Colon cancer is right behind there. So if you're a man, if you're over 45, get your, actually both of you, men and women over 45, get your colonoscopy. Now, every once in a while, you can find someone who falls out of that age range. So you get someone like Chadwick Boseman, who was only, I think it's 42.
He was very young.
Yeah, he was young. He went in a screening age, but and that's another reason it's important to know your medical history, your family history, because if we start screening for cancers about 10 years before your relative developed that. So if you said if someone come to me and said, yeah, my brother had prostate cancer at 50, well, we're not going to start waiting to 50 to start screening him. We're going to start screening him at 40. We want to go 10 years before that. But yeah, for a colonoscopy, 45, same thing. If you can't do the colonoscopy, then do something like Cologuard, or there's other tests you can do. But the preferred one would be the colonoscopy, because you get that done. If it's clean, you're good for 10 years and got to worry about it again. The Cologuard, you got to do it again in 3 years. Women, breast cancer, screening for breast cancer, 40. And we kind of go back and forth about the age for that, but basically, I think people genuinely agree 40 years old is a good age to start screening for your mammograms. And then for colon cancer, we talked about prostate cancer, 45 if you're high risk. So if you're African American, we consider that high risk. So we consider 45 the screening age for that. Otherwise, it's 50. Or if you have a first degree relative, like a brother or a father, then you should screen at 45 for that group. And then lung cancer. This is one that's probably under screened. So there's an organization called the U.S. Preventive Services Task Force, and they make recommendations about screening tests. So like the Pap smears and the mammograms and all that. So there was a time where people were getting chest X-rays to screen for lung cancer. And what they found was that by the time you were able to detect a cancer on an X-ray, it really didn't make a difference as far as the life, extending your lifespan, because by that time you probably would have started having some symptoms. You'd have a cough, you'd have blood in your sputum, you have something that indicated that the cancer was there. So doing an X-ray didn't shorten that period. Not only that, the X-rays, of course, have radiation, which increases your risk for cancer. So X-rays are out for screening. But as time went on, and going back to research, what they found doing research was that doing a low-density CAT scan can detect cancer early enough that it can make a difference. So for anybody who's had a 15 pack year history. So we consider that equivalent to smoking for 15 years, a pack a day for 15 years. If you're a smoker and you smoked within the last 15 years, then doing that low density CAT scan is something that would detect the cancer early enough. So when you talk to your doctor about screening, ask for that lung cancer screening as a low density CAT scan. Good thing about it is that the Affordable Care Act mandates that insurance companies cover it, so you don't get billed for it. So ask your doctor for it. But better yet, quit smoking.
So you mentioned also the 15 years. So people that have smoked 15 years, one pack of cigarettes, that's going to be something that's going to affect them a lot quicker with cancer, possibly.
Yeah. So the longer you smoke, of course, the more. So you got people that smoke, the chain smokers. They might smoke 2 packs a day. Their risk is higher than someone who smokes 1 pack a day, and also the length of time that you smoke.
This is Karen Dotson from the All of Us Research Program at the Medical College of Wisconsin, along with Dr. Kevin Izzard. We're going to take a quick break. If you're interested in talking to us, coming and sitting at the table with us today, please call us at 414-444-5250. That's 414-444-5250. We'll be back on the other side.
Milwaukee, you've seen prices rise.
program. I have Dr. Kevin Izzard with us. Good morning. And it's kind of rainy. It's a little cloudy. We had a big 4th of July yesterday, right in almost the middle of the week, which kind of threw us all off. But we're here today to talk about something that we know that a lot of people probably did yesterday is alcohol, and also how it affects those with cancer and high risk individuals with the possibility of cancer as well.
Hey, I gotta make a correction. So, in the last segment, I said that the screening age was or the threshold for getting that low density CAT scan was 15 pack years. It's 20 pack years. So it's equivalent of smoking a pack a day for 20 years. But you had to have smoked within the last 15 years. So that's where the 15 came from. But yeah, so if you've been a smoker, if you're over age 50 and you smoked the equivalent of a pack a day of cigarettes for 20 years. So again, that could be, so we consider a pack year the equivalent of a pack a day for a year. So 20 pack years, the equivalent of a pack a day for 20 years. It could also be if you smoke 2 packs a day for 10 years, that would be the equivalent. So, but yeah, see your doctor about getting screened for that, because that's a test that is being underutilized. People aren't getting that test.
And one thing when I was reading, it also spoke about the issues where when you smoke and drink, it allows for the cells not to really fight some of those other things that are going on with the chemicals of the cigarettes related to your mouth, and a lot of times that's how cancer of the mouth, the throat.
Yeah, right. So even people who don't smoke, because what we think about the cigarette smoking is really it's not the nicotine in the cigarettes, it's the carcinogens. It's that burning, that tobacco that causes these chemicals or free radicals in your system that actually interact and cause cancers. But we know that even people who chew tobacco, increases your risk for head and neck cancer and mouth cancer, throat cancer. So if you can avoid it, smoking is bad news. My mom used to smoke when I was a kid. I remember going to the store when I was a kid. She'd write a note.
Yeah, at that time you could do that,
yeah,
right?
Right now I take it to the store, get her a pack of more regular cigarettes. It got to be the red ones, not the menthol. And then bring it home, and they can't sell cigarette to minors anymore, even with a note. But yeah, things have changed a lot, with smoking. Back in the day, back in the in the late 50s, 60s, they used to you see some of these commercials with doctors, saying, "Oh, smoking is good for you. It increases the blood flow to your lungs and that kind of stuff." And this was before the information, and the Surgeon General came out and said that smoking causes cancer, and they labeled that on all the cigarettes. But for a long time, smoking was really sexy and cool, and you see actors and actresses and in movies with cigarettes. It really promoted that, and now I see young people who are picking up smoking, and I'm saying, do you realize I got people who are older than you who wish they could quit, but
what about the vapors?
The vapors. We don't know enough about vaping yet to give any conclusive information, but my thoughts is this. I'm pretty sure that at some point we're going to find down the line that vaping is probably as dangerous as smoking cigarettes. Again, I have no evidence for that yet, but I'm pretty sure that that's going to be scarring the lungs. And at some point we're going to find, maybe after vaping's been around for 20, 30 years, we're going to find that, it's causing lung problems. So I do tell people, if they're vaping to try to quit smoking cigarettes, well, I'd rather for you to vape for something, because vaping is something I don't know for sure causes problems, even though it probably does, versus cigarette smoking, which I know causes problems. I'd rather for you to vape than to smoke cigarettes. But the vaping thing is really of concern, because a lot of young people are vaping. And so we don't know what's going to happen to those people 20 years from now, 30 years from now. So that's a concern. So, better yet, don't do any of it.
And we're talking today. We're sitting at the table. We're asking you to call in and sit at the table with us. Some of you all might just be getting your coffee, your tea this morning, your juice. So I want to welcome you to the table. This is Karen Dotson from the All of Us Research Program at the Medical College of Wisconsin. And we have Dr. Kevin Izzard joining us today just to talk more about what it takes related to alcohol and also cancer. And we had to put in there about smoking as well, because there are some interrelationships with people that drink,
Hmm.
also smoke a lot,
Yeah.
or vice versa sometimes.
I got
But
people that tell me that they don't really smoke until they unless they're going out and drinking. So
wow,
they
yeah,
they kind of associate those things
the
together.
cigarette with the alcohol just
Yeah, yeah.
does good together. And so that's something that people, and I say does good together for them, but not
Hmm.
for your body, right?
Right,
So
right,
I want to
right.
make sure I clarify that.
Mm,
But also, when I was thinking about alcohol
mm-hmm.
and I was looking at, how it affects women, and it mentions that it also can increase the levels of estrogen in your body.
Mm-hmm.
And those that are suffering with breast cancer, how does that work,
Yeah,
Dr. Izzard?
yeah. So right, so you would definitely want to, if you have estrogen sensitive breast cancer, you want to avoid alcohol. Um, this might be interesting for men because we know that men that drink too much and that estrogen can actually cause, it's called gynecomastia. So men who develop breast tissue. So that might be something that's contributing to that also. And if you're concerned about your testosterone level and your sex drive, that can be all that can be thrown off by alcohol. So how do you know if you drink too much alcohol? Because again, I said Wisconsin, we're a big drinking state, and so it's all relative. So we might think, oh, well, everybody around me, drinks beer, so I got a 6-pack in the refrigerator, and I just kind of drink it, when it's hot outside. So we kind of have a skewed view of how much is normal. So we got the screening test that we do called CAGE questionnaire, CAGE. And so it's kind of something we use to kind of screen for whether if you have an alcohol consumption problem. So C stands for cut out or cut down. So we ask people, do you ever feel like feel like you need to cut down how much you drink? That's one of those red flags if you feel like you need to cut down, because either you're concerned about how much you're drinking, or other people around you are concerned about how much you're drinking. A is for annoyed. Are you getting annoyed by people talking about your drinking? Again, that's another red flag if people are annoyed by your drinking, or you're annoyed because people are bugging you about how much you drink. Uh, G is for guilt. Do you feel guilty about how much you're drinking? And then the last one is E. Do you feel like you need an eye opener that you even drink in the morning or early in the day as an eye opener to get you going? So those are questions that if you answer yes to them, might indicate that you have a drinking problem. And so there's something to discuss with your doctor. A lot of times people don't disclose that stuff, and unless we ask specifically, people won't voluntarily tell you about it. But yeah, though, if you answer yes to any of those questions, you should really reassess how much you're drinking and probably have a conversation with your doctor about it.
That's one thing that you mentioned that I would want to bring to the attention is that the All of Us Research Program, we have like a survey that when you join our program, we ask certain questions about your health, your behaviors. And um, it was interesting that it said that the researchers counted more than 15,000 All of Us participants who reported a cancer diagnosis. Of these, nearly 4 of 5 said they currently drink alcohol. And so it shows that a lot of people, even though they've been diagnosed with cancer, they still drink alcohol. And it can really affect them in multiple different ways. And when I was also doing my research, it mentioned that the factors that are important as far as some of the things that alcohol can affect are different types of cancers. Like you might have cancer in one place, and if you drink a lot, it might reoccur somewhere else.
Hmm.
Dr. Izzard, you want to speak to that?
Yeah, yeah. So like we mentioned before, your immune system is very important in kind of keeping cancer cells, rogue cells, keep them at bay. And so when your immune system is affected, those cancers can get active again and spread. And again, your immune system is not knocking them down. So I would say, if you have any kind of cancer, whether it's lung cancer, prostate cancer, colon cancer, cervical cancer, that if you've been treated for that condition, you need to really reassess your life and take out those things that might contribute to your cancer coming back. And that's talking about your diet and your drinking.
One thing I always want to tell people, regardless, when you go to the doctor, be honest. I know I am. I'm totally honest when when you go see a lawyer or a doctor, this is where you're honest with them, because they won't be able to help you if you don't come clean.
That's the truth.
Okay. And so when I go to the doctor's office, I'll say all these different things. And one time my doctor said, well, Karen, it looks like you need to exercise more. Looks like, you're out of shape. And I was like, okay. And so don't tell them about everything else until you get yourself in order.
That's right. Yeah.
And so, but seriously, it's important, because the type of treatment that you might be receiving, if you don't tell your physician that you are drinking, it could affect the medication, the results of that medication.
Yeah. A lot of times, I might find out from the wife. The wife will call me after the husband had a visit and says, "Did he tell you how much he drinks?"
We always be looking out for him, aren't we?
Devo's over here laughing. Yeah, the wife will tell. Yeah. But yeah, a lot of times, either they don't consider the problem, or they don't want to address it, or they don't want to have to, because when you're confronted with it, now you have to address it. And so, a lot of times people kind of blow it off. I had one guy who I just found out he had been drinking a lot and hadn't really disclosed it. He came back and he had stopped drinking. He's now in AA and is actually sponsoring his first person. And it's almost a religious experience to have going through AA. He had to reassess his life. He had to apologize to people he had wronged, and I was listening to him talk about his experience with AA. It is, you're fellowshipping with other people, other alcoholics, other sinners, as we would put in the religious community, and you have to acknowledge your sins, and then make amends for them. That's part of, again, it's a religious experience. And then you have to come to terms that, that you have this addiction, and that you have to submit to, now they say a higher power, in the religious community, we talk about that being God. But now this whole thing about you can make a chair your higher power, I don't know about that. You got to find something that, really that you think is higher than you. And, but yeah, that's AA's been around for a long time, and it changed a whole lot of people's lives. But yeah, this guy had not disclosed to me that, how much he was drinking. And it just kind of undercuts this whole thing about, well, not undercuts, but kind of supports this whole idea that, unless we're screening for it, a lot of times people won't tell you. So discuss these things with your provider. First of all, have a provider. You got to have a doctor, nurse practitioner, physician assistant, somebody that you see who knows you, because when you know somebody, you can see things start to happen. You can see that, oh man, okay, so you got a DWI. What happened? What's going on here? Or why did your wife drive you in? Well, you lost your license. Why is that? Or you've been missing a lot of work. Or you're in the ER a lot for stuff. What's going on? Or you got a tremor. So a lot of these things are kind of subtle. And if you're just getting your care in the emergency room, people aren't going to pick up on these things, and the people aren't going to really screen for them. So you got to get in and get your, get your screening visits, your preventative health visits. But and as Karen said, you gotta be honest. You gotta disclose those things, because people can't help you if you don't disclose it. And and again, there's a lot of rules about confidentiality rules. So I can't tell someone's wife that they something's going on. Now sometimes the wife will call me and tell me, but I can't really, tell her back unless I got permission from that person. Um,
So you would just say thank you for the information and not say if he did or did not say
Yep,
anything.
yep. And I said, yeah, thank you. I said, I can't really discuss this, discuss it back with you, but I will address this with him.
All right. You know, start looking at what is considered hazardous drinking. So I'm going to break this down a little bit. It says one serving of alcohol equals one bottle of beer, that's 12 ounces, a glass of malt liquor, 8 ounces, wine, 5 ounces, and a shot, 1.5 ounces, as considered serving. But then when you start looking at what is considered hazardous drinking 3 or 4 drinks a day, 2 to 3 times a week. So that's only 3 to 4 drinks a day, 2 to 3 times a week is
Mhm.
considered hazardous. Drinking 5 or 6 drinks at a time, 2 to 4 times a month is considered hazardous. And drinking 4 or more times a week is considered hazardous.
Mm-hmm.
And I think about it like, how many people do we know that really sometimes do that?
Yeah. Yeah.
And so is it better to maybe, if you're going to do it in excessive, just do it like every once in a while? I mean, because some people are like, well, every once in a while, I just need a little bit more, doctor.
Right. Right. I think it's more of a, because you talk about, again, I talk about how you just disperse that alcohol, whether it's 2 drinks a day or whether it's 14 drinks on a Friday and Saturday. So, I mean, technically your body's able to, to detoxify and keep up with 2 drinks. But if you're drinking every day, even just 2 drinks, it causes the question, why? Why are you drinking? Why do you feel the need to drink alcohol every day? And so, and again, and that goes back to those questions we were asking about, is there some underlying issue that you're drinking to address? So do you have anxiety? Do you have something else going on? And then that puts you at a higher risk for other things, so you're more prone to over consuming and over drinking if you have those other things going on.
And that is what we need to think about. Why are we really doing it? Because sometimes, you go through a hard day, you say, I need a drink.
Mm-hmm.
And sometimes it's almost like, do we really need a drink or do we really need to look at the issue? Because once we finish drinking, the issue is still there.
Mm-hmm. Mm-hmm.
And so looking at how we handle things is so important as well.
Yeah. The other thing too is I want to throw some support for people family members, who are dealing with, with an alcoholic. Some of them, are all open and some of them are kind of closeted, but that has a huge toll on people's families, kids and spouses. We talk about men, but women women alcoholics too, and so, they got Al-Anon, these other groups that are for family members of alcoholics. But yeah, it can be even harder on them because they're dealing with all the problems with it. Their loved one missing work, maybe not bringing home the paycheck because they can't keep a job. They're abusive at home. They're doing all these things and they can't make them do anything. They can't make them get treatment. They can't make them, take this thing seriously. And so it can be very frustrating and can very, have a lot of, children of alcoholics, can first of all, they, it affects them growing up socially, but also they inherit those genes, so they're more prone to themselves becoming alcoholic. So you got that addictive behavior gene, so maybe they might not drink, but maybe they smoke marijuana every day, or they're doing something else that's, they have a predisposition for it because of that gene that they inherited from their parent.
You mentioned something that is really important when you said marijuana. So smoking marijuana can also do the same effects of smoking cigarettes, Dr.
Oh boy! So this is something that's very interesting. So for years, the marijuana is a Schedule 1 drug, meaning that the FDA says that there's no value of it for medical purposes nor for research, and so the Congress made laws that you can't even do research using marijuana. And now they're backing off on that because we need to know what effects does smoking marijuana have, especially now that a lot of states, in fact, half of the states now have either medical marijuana what we call medicinal marijuana, or marijuana just for recreational marijuana. And so Wisconsin, I'm sure it's going to be coming here. It's just a matter of time. And as more people start to smoke, we're going to start seeing more things. What effect does it have on the lungs? Does it have the same effect as smoking cigarettes? We don't really know that. How about, as far as the big problem with marijuana is this: it's hard. Like for alcohol, there's a direct correlation between how much you drink and your blood alcohol level, and then you can do a breathalyzer and test what someone's alcohol level is based on how much alcohol they're exhaling when they do the breath test, or you can do a blood test again. But for marijuana, it's not the same. There is no breath test you can do for marijuana, although sometimes for those of us who've been around people who smoke, especially that skunk stuff, you walk in a room, you can tell
You know
they smoke.
Yeah, you know where they've been or what they've been doing. Right, right.
But they're and people who are daily smokers for marijuana, it doesn't have the same impact on them as someone who smokes occasionally, and so it's hard to regulate when someone is intoxicated from marijuana. So it's not an easy thing to screen for. Like, if you get pulled over for a drink, and they can do a breathalyzer, and they can tell what your level is, but they can't do the same thing for smoking marijuana. So it does become problematic.
And it can also affect the lungs and things like that too, as well, right?
Right. So there's a whole lot of research to be done yet on daily smoking of marijuana and what effect it has on people's health.
We have at the table, we have Deb Nevels joining us. Good morning.
Good morning.
Deb Nevels.
Good morning. Hey, I'm good.
I found out last time that Deb and I went to middle school. We went to Webster Middle School.
Webster Middle School.
Yep. And I didn't connect the last name. I said, Deb. Deb said, "Look at me. Do you remember me?" And I'm thinking, now my mind had to go back, 20 years. Actually, more than that.
We won't talk about it.
We won't talk about that. Yeah, but Debbie Davis.
It's too funny. Well, I was listening on my way in, and I wanted to, and you circled back to it. The one thing with cigarette smoke, and one thing that's really popular nowadays that I am asking researchers at the medical college to please start doing research, because there is not enough research on it, is hookah.
Ooh, yes. I would like to know that. I see so much of that now.
Yeah. So understanding that the amount of, if you sit down and smoke hookah, it is 100 to 200 times more smoke than if you smoke a single cigarette.
I see that in the cars and different places. I'm like, how can all that come out of one person?
Yeah, it's the tall ones that they have those hookah bars and stuff.
Yeah, right.
Yeah. And people have the hookah at their home. It is
hookah parties or whatever.
Yeah, it's like smoking 100 cigarettes in one sitting and smoking a hookah. And so, and it's more and more younger people are smoking it. And so my concern is, like you were saying, and like I said, I was listening on the radio, if a doctor asks you how many packs of cigarettes you smoke, that's the standard language, especially to determine if you should be screened for lung cancer. They don't ask about hookah. And I don't know, not everybody, but I'm saying, but docs out that it's not on the list. And so if somebody is like 27 years old and is having respiratory issues, it's like, okay, do you smoke cigarettes? It's like, no. You might ask if they smoke marijuana, but there's not a question of if you smoke hookahs.
Right. Yeah. So I ask people, I say, when I say, do you smoke? And they say, you mean like cigarettes? Yeah. I know what that means.
Okay. They try to turn it like, okay, just the cigarettes, but the other stuff.
No, but yeah. So if they smoke marijuana, that's kind of a tale when they say, I say, do you smoke? You mean like cigarettes? Okay.
Well, anything similar. Right. Anything similar.
Yeah, but we don't know. We don't know really, what, because I at the screening we ask about, do you smoke cigarettes, but we don't ask about vaping. And and even with vaping, some of it has nicotine, some of it doesn't. So if you even ask, do you consume nicotine? So we don't have a really good way for screening for those things, and we don't know if the risk of vaping has the same risk as smoking cigarettes.
This is Karen Dotson, and you're at the table with us this morning. I have Dr. Kevin Izzard. Also, I have Deb Nevels from the Medical College of Wisconsin with community outreach and engagement. at the Cancer Center. We're going to come back and we're going to have another special guest. And Deb, I want you to introduce her. Can you let us know who's going to be next joining us?
It is special, very, very special. A friend of mine, Dr. Noelle LeConte. She is from UW-Madison Carbone Cancer Center, and her specialty is alcohol and cancer.
So she's done a lot of research in
Yes,
that area. So we're going to have some deep conversation coming. I'm just going to ask that you stay tuned and stick with us and sit at the table with us this morning. You can call in at 414-444-5250. We'll see you back on the other side. So Deb Nevels.
Good morning. Good morning.
And we also have another special guest that Deb is going to introduce us. Just reading her bio just makes me so happy to be able to talk to someone that can give us some really good answers and also say what else is needed. So we believe in educating the community. So that's what we're doing this morning.
Yeah, and this guest, a friend of mine coming from us, all the way from Madison. I'm sounding like that's like out of the country.
It's just
not.
What, an hour away or so there.
It's only an hour away. But from UW Madison Carbone Cancer Center, Dr. Noelle LeConte. She's an oncologist and also an associate professor in the Division of Hematology, Medical Oncology, and Palliative Care within the Department of Medicine. She does a lot of research, and her passion is alcohol and the relationship to cancer burden and cancer incidence. So that's why she's joining us here today.
Good morning, Dr. LeConte.
Good morning, everybody. So happy
Good
to be
morning.
Good
morning.
morning.
Hello.
Pull up a chair.
Okay.
Got your coffee?
Here I am.
You got your coffee, your tea, your juice, and thank you for joining us at the table this morning. where
Happy to be
do
here.
yes, where do we begin? Can you just give us an overview of some of the work that you have done and some of what you have found to be most encouraging and also alarming?
Yes. Yeah, thanks for the question. Briefly, I got into this because I was filling out death certificates. Dr. Izzard probably has to do this too, where we check a box that says, did alcohol contribute to this death? And I was talking to my partners, and we didn't even know when to check yes to the alcohol box when a patient died of cancer. And that told me, if I don't know as an oncologist, community members probably don't know either. So that led me to help write a policy statement for the Society for Oncologists, Cancer Doctors. And that just summarized some of the data, but also set forth policy measures that we support to reduce alcohol-associated cancers. And all my research has kind of fallen from that. So it's 7 types of cancer. The more you drink, the higher your risk. The more consistently you drink, the higher your risk. I'm particularly worried in Wisconsin because we have high rates of alcohol use, but really high rates of binge drinking, which is lots of drinks at one, sitting, like pre-gaming or whatever, tailgating, that kind of thing. But and I'm sure Dr. Izzard has seen this too. Alcohol can just wreck an entire family. And you see tremendous regret from patients after they develop a cancer from their drinking and wish they could do things different. So my main goal is just education so people can make choices in line with their values.
You said something that really struck me, because a lot of events, especially here in Wisconsin, there's alcohol involved in it. You go to the Brewer game, there's tailgating, there's drinking. You go to the Packer game, there's drinking. You have a party, there's drinking. I'm planning my 30th wedding anniversary, and none of us drink, so we're not gonna have drinking. But you have a party, you plan a party, and you got to have an open bar. So you have a wedding, there's drinking. So we have drinking so much involved in our kind of built into our activities in our culture.
Yeah, it's actually harder not to drink. I tried not drinking for a month just to see what it was like for my patients, and sometimes it's easier to just take a drink than to say no.
Wow, that's deep.
So it's easier to take a drink than to say no. Is it because you want to be more sociable, or you want to socialize more with people, or what do you mean by that?
Well, and I mean, think about if you're at a party or a wedding, let's say, where there's a signature cocktail, there's an open bar, and you don't want to drink. So your options are you can have a bottled water or a Coke. And pretty much everybody knows you're not drinking, and then they'll make assumptions about why, or that you're fun sponge, or, why can't we have adult drinks that are also enjoyable? We have different taste profiles. Like maybe we want some kind of, adult friendly beverage that just doesn't have alcohol in it. But oftentimes that's a difficult thing to find.
Yeah. And also, I was just thinking about what you said about when you go to those events, instead of getting the glass, because they do give you different types of glasses with soda and water. Next time, tell them to put it in a cocktail glass.
Right?
With a
cherry or something,
Lime.
to make it so it doesn't seem so. I mean, there's ways of getting around it too.
But you know what? I personally, I always try to, people know I don't drink. I try to make it people realize I can have fun and not drink. I can still be, a friendly, social person. We can talk to you, and I don't have to have a drink in my hand.
How do you do that, doctor? You just have that
Yeah,
knack.
right.
You just say, I don't care. I'm just going to have fun today.
Exactly, right. Yeah, and now, of course, they have mocktails too. So a lot of places will have these, these mock cocktails if you want to go that route. But you can have fun without being intoxicated. Yeah.
So doctor, can you just tell me exactly what are some of the biggest challenges that you feel that your patients have, or looking at the research with the alcohol and also cancer? Because I know you've seen quite a bit in doing your research and also in your practice of working and providing care for individuals.
Yeah, I mean, there's a couple challenges. One is just how culturally acceptable it is to drink, which we've touched on. The other is that there's this persistent myth that a little bit of drinking might be good for your heart, which I think has now been fully debunked in my mind, but was very persistent for a very long period of time. And so when there's this kind of noise in the media where people hear like maybe a little drinking is good, maybe it's bad, what happens for lay public is they kind of tune the whole message out. You sort of say, well, the science isn't settled. I'm just going to choose to believe what I want to believe, which is that a little bit of alcohol isn't that bad. But the reality is, from a cancer prevention standpoint, which I realize not everybody makes decisions based solely on cancer, but from a cancer prevention standpoint, there is no safe amount of alcohol.
No safe amount of alcohol.
Yeah, we were just talking about that during the break about how that we've changed that that opinion about a small amount of alcohol daily was protective for heart disease, and how we're rethinking that now.
Yeah, because I remember just reading that having a glass of red wine a day or something like that would help your heart. I've heard that, and people, they were doing studies over in like Europe, or why are those people, because they have wine at dinner and they seem to live longer. Speak to that.
Yeah. Well, I think, a lot of times, I'm sorry, but I think a lot of times we kind of underestimate the fact that, first of all, how much we're drinking, but also that a lot of these people are taking other medications. And so now this alcohol is interacting with other things, so they're on blood thinners and now they're drinking alcohol on top of that, and we don't always consider those things when we say, oh, just have a couple of drinks a day, and that's okay.
Dr.
I
LeConte.
think it ties back to what's called an abstainer bias, meaning we will never have a randomized trial where half the patients take a drink or two a day and half take none. So our best data is going to be asking people retrospectively or even prospectively, how much are you drinking? So food diary type trials. And when you ask people that, there's reasons why people don't drink. There's people that lifelong never drank for religious reasons. There's people that don't drink because they've had some harms come to them because of alcohol. Maybe they have cirrhosis, maybe they've had a heart attack or stroke, and they've chosen to